Welcome, 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 welcome. How are you guys doing? Where is everybody? Let's get to work. All right. We shall be discussing stopping metformin. When is it okay to stop metformin? When is it okay to stop metformin is today's topic. But before we start, before we go into that topic, to discuss when is it okay to stop metformin, there are a couple of questions that I received that I need to answer. There are a couple of questions on yesterday. Yesterday we discussed the side effect of metformin. Yesterday. So I received a couple of questions. So I'm going to address those questions before we go into today's All right. How are you? Sorry about that. Sorry, excuse me. Sorry about that. As soon as I go online, I start getting, I don't know why people wait till when I go online on a live video before they start getting in touch with me. So I received a couple of questions yesterday. Maureen, you're welcome. I received a couple of questions yesterday. We did on the side effect of metformin. We did side effect of metformin, and then I got a couple of questions. So I'm going to address those questions before we go on today's topic. When is it okay to stopping metformin? When is it okay? So I want to answer those questions briefly. I have about 5 questions that we are going to answer. I'm going to answer from yesterday's program, and then we'll go into today's program. And the first question I answered is, let me just share the question with you guys. Okay. Let me just share the first question with you guys. Please, once you join the program, indicate to me where you're watching from so that I can acknowledge your presence. I need to know where you're watching from. Kindly indicate to me where you're watching from, please. It's important to acknowledge your presence. Okay. So this is the first question I received yesterday, and I saw it today and some yesterday. So we're going to answer 5 questions before we go into today's program. It says, what exactly does metformin do to your body? All right. So that is, excuse me, just a minute. Let me just attend. I'll be right back. Sorry about that. Safia to Jalo, you're welcome. Stephanie, you're welcome. All right. Okay. This is the first question, all right, that I received yesterday. What does metformin do to your body? Okay. Now, what metformin, as I said yesterday, metformin is not used to cure diabetes. Diabetes has no cure. Rather, metformin is used to lower your glucose level by decreasing the amount of glucose produced by your liver and increasing the cell's sensitivity. So metformin, it is not used. No any diabetes medication is used to cure diabetes. Rather, any medication you are taking, okay, it is used to lower your blood sugar levels by decreasing the amount of glucose produced by the liver and then increase the sensitivity of the cells. You have so that your cells of your body is going to increase the sensitivity, and when you have your muscle cells to be sensitive to the hormone called insulin, it's going to allow more glucose to be taken or absorbed from the blood into the cells of your muscle. That is what the use of metformin. So metformin, it is not used to cure diabetes. Rather, it is used to lower the amount of glucose level in your bloodstreams, okay, by decreasing the amount that is produced by the liver. And also it will increase the sensitivity of the muscles of the cells. And so when you increase the sensitivity of the muscles of the cells, it allows glucose to be absorbed from the blood and then stored into the liver or stored into the cells of your muscles to be used as fuel, as a source of energy. All right, that is what metformin does. That is exactly what metformin does. All right, that's exactly what it does. So I'm on a live video. Okay, so that is the answer to that first question that I just answered. That is answer to that first question. So let's go to the second question. All right. The second question is, what is the most serious side effect of metformin? What is this most serious side effect of metformin? Okay. What is the serious side effect of metformin? Yesterday I said it. I'm not talking about a common side effect. There's something I mentioned yesterday about the serious side effect that you will be needing medical attention at the hospital. Probably you might be admitted. That one you can't treat at home. Once you have that serious side effect, you have to rush yourself to the hospital to be treated. That's when the acid in your body, in your stomach, is pushed up, okay, into your esophagus. Okay, it's a serious side effect. I call it lactic acidosis. Okay. I don't know if you guys remember this. The serious side effect of metformin is when you have this. It's when you have lactic acidosis. Okay? Lactic acidosis is life-threatening condition characterized by buildup of lactic acid in the bloodstreams. All right? So this is when you have lactic acidosis, that is a serious side effect of metformin. There's a buildup of lactic acid in the bloodstreams. So that's the serious side effect. This one is life-threatening. When you have lactic acidosis, it's life-threatening that you have to be rushed to the hospital. So that is the most serious side effect. That is the most serious side effect of metformin. So let's go to the next question. The next question is, what should you avoid while taking metformin? This one, everybody can answer it. Okay? There are a lot of things you can avoid while taking metformin. What should you avoid while taking metformin? Okay? Okay, this one, everybody can avoid it. It applies to every drug that you are taking. Once you are taking medication, there are something doctors advise you to avoid at all times. Now, when you are taking metformin, okay, it interacts with other medications. And that is why I said yesterday, if you are taking metformin and you are already taking other medications, please talk to your doctor before taking that metformin. For instance, if you are in another medication, either you buy it from the pharmacy or another doctor prescribe you that medication, and then you have to go to another doctor who is treating your diabetes, and then he has to prescribe you a metformin. Already you are taking other medications. Let the doctor that is giving you metformin now to know that you are taking these medications. Is it comparable? Is it okay to take metformin on top of these medications? So doctors will know, because metformin interact with other medications and it's going to give you other side effects like seizures. Blood is going to maybe increase your blood pressure or heartburn or cholesterol. So always discuss with your doctor when you are taking other medications to let him or her know that I'm already on this medication. Adding metformin to this medication is going to cause me any problem or side effect. Now, if you are not taking any medication already and then you have been prescribed metformin and then you happen to go home and buy another medication from the pharmacy, do not take that medication until you report back to the doctor if you can take this additional medicine on top of that metformin. So you always must have to consult your doctor. Now, one thing you have to avoid while taking metformin or other medication is alcohol. Alcohol must not be combined with medications. Anytime you start taking medication, you have to stop taking alcohol, no matter what. Medication doesn't go well with alcohol. They are two different opposite sides. They go opposite, and there is like positive and negative. There's no way positive and negative can meet. So once you are on any medications and you are an alcohol drinker, you have to stop that alcohol until you finish taking your medication. Then you can resume your alcohol. In no circumstance should you be taking medication at the same time taking alcohol. They cannot work together. It's going to cause you a serious problem and become a life-threatening. So that is one thing you have to avoid at all times when taking metformin or other medications. Okay. Now, there's this question that I received. Okay. I don't know if it's going to apply to you guys. Let me get that question. This question, I received this question. I don't know if it's going to be applied to you guys. Why do doctors no longer recommend metformin? Okay. As I said, there's a caveat in this question, depending on your location. There's a caveat in this particular question. It might not apply to you, depending on your location. There was a time metformin was discontinued because of there was a severe side effect, and it was discontinued to go back to reapproval. And then after all going through the process again, it was approved and put back in the market. So during that short time that metformin was put out of the market, doctors don't recommend it anymore until it was reassessed and then corrected and then pushed out to start being recommended for treatment of type 2 diabetes. So that is when that particular period, it was discontinued. Doctors stopped recommending it. So it might not apply to you depending on your country of locations. Now, apart from that issue, metformin is one of the drugs that is being used to treat type 2 diabetes due to its own effectiveness. It works. All right. Now, doctors use it as a first line of defense in treating diabetes, especially type 2 diabetes, because of the effectiveness. Now, some other doctors don't use it as the first line of treatment. Okay, they start you with other medications and then fall back later with metformin. Now, the reason being is that, okay, there are some patients that their body doesn't tolerate metformin. Okay, so there are particular patients that metformin, their body cannot tolerate it. So doctors don't use it as a first line of treatment. So they use other medications. Then at the second time, they will fall back to it and start using it. Your body might not tolerate it at the first line of treatment, but in the second line of treatment, when your body has been used to other medications in treating type 2 diabetes, now doctors might fall back to it as the second line of treatment, having established first line of treatment with diabetes, because your body is now used to some other drugs for treating diabetes. So now doctors might discontinue that medications and they bring you back to metformin as the second line of treatment. So they start you with other medications so that your body will tolerate that medications for type 2 diabetes. And after a while, doctor will stop you and then switch you back to metformin. The reason being is that using metformin as the first line of treatment, your body might not tolerate it, because there are certain patients, there are certain people that their body doesn't tolerate metformin as the first line of treatment. They use it as the second line. So doctors are going to use other medications to start you as the first line of treatment. Then after a while, they stop that medication and they reintroduce metformin as the second line of treatment. Then your body is going to tolerate it. So these are some of the reasons why doctors are, two reasons. The first one is there's a period of time it was discontinued due to it was having a serious side effect to certain patients. Then they stop it. Okay, they don't recommend it anymore, and then they reassess the medication to reapprove it again, and they correct the problem and they reintroduce it to the market again. So that is why I say on these particular questions, it might not apply to you depending on your location. All right. So that is the question that I received yesterday. So we have to go back to what we're supposed to discuss today. Stopping metformin, what you should know. When is it okay to stop metformin? Do we have any question? Do you have any question? I don't know why this guy came here. You saw that somebody is here. Do you have any question before we continue? I want to know who and who is watching. I want to know how many of who and who is available, who is watching right now. Who and who is available right now? Do I have any question before we go into today's topic? When is it okay to stop taking metformin is the topic we're going to discuss today. When is it okay to stop taking metformin? Something is wrong with my network. I'm going to refresh and come back. I'm having an issue with my network. I'm going to refresh and come back. I'm going to reboot and come back again. All right.